Hi everyone, I'm Liana Smale from American Forests, and I'm going to be talking to you about why tree equity is health equity. But before I get into what tree equity is, I want to first talk about the health benefits of trees. So treescapes reduce the risk of dying from cardiovascular and respiratory diseases by between 8 to 12%. Being around trees in your city reduces anxiety, helps children focus better in school, increases birth weights, helps people recover from surgery faster, and there's so many other benefits backed by research that you can learn more about from this QR code. I'll keep it up on the next slide. But the issue arises when we look at who has access to trees and green space in their cities and who doesn't. These are just some of the articles that we've seen in the news recently about this disparity, which we call tree inequity. Communities can still feel the impact of decades of disinvestment and discriminatory policies like redlining, and that shows up in the data. Across the country, lower income communities have 26% less tree cover and are up to 6 degrees hotter than wealthier communities. And regardless of income, communities of color have less tree canopy and are even hotter. This is an example of how you can use our tool, Tree Equity Score, to see how neighborhoods in any urban area in the US compare and to identify where trees are needed the most when you combine socioeconomic factors with health and environmental burdens. So if I could wave my magic wand, cities and societies would become healthier by 1, classifying trees as critical health infrastructure and funding them as such. 2, embedding exposure to nature in prescriptions and health insurance incentives. And 3, planting and caring for adequate tree cover in communities where the health burden is the highest. Thank you, and feel free to reach out.